is Natalie Sandlin, and I will be presenting on the infectious disease botulism. Botulism is a very rare yet fatal illness caused by the toxin from the bacterium Clostridium botulinum attacking the nerves of the body. So C. botulinum is a gram-positive, rod-shaped bacteria that grows anaerobically. It also forms spores that can resist extreme environments. And so even when the bacteria itself dies in harsh conditions, the spores can remain viable and regrow once optimal conditions arise. So this bacteria produces a toxin that's considered one of the most lethal substances known. It's actually what earns this disease a spot on the bioterrorism category A list. C. botulinum is found naturally in many environments, including soil and marine sediment. So the botulinum toxin is a neurotoxin, and it has 7 distinct forms, types A through G. Only 4 of these can cause human botulism, and those are A, B, E, and F. So the way that this toxin works is it interacts with nerve cells, particularly motor nerves, and prevents neurotransmitter from being released, and it causes flaccid muscle paralysis. Just like a more in-depth look at this mechanism, so the toxin binds to the axon of the nerve cell, and it prohibits acetylcholine, which is a neurotransmitter, from being released and stimulating muscle fiber. And so the blockage of this stimulation is what causes paralysis. There's 5 manifestations of this disease, the most common being foodborne botulism. And so that's from eating contaminated food that has the botulism toxin in it. And this mainly comes from home canned products. So any home canning vegetables or foods that weren't canned properly could have this contamination in it. Wound botulism is another one that can occur, and this is when the bacteria infects open wounds and the toxin is released. And so this mainly occurs with intravenous drug users just because they have those open wounds on them. Infant botulism is where the bacteria infects the intestines and produces the toxin there. This occurs naturally in infants, and there's not actually a reason known why it causes it, but raw honey can actually increase the chances of infant botulism also. Adult intestinal toxemia botulism is very rare, but it's a similar manifestation to infant botulism, just in adults instead. But like I said, it's supremely rare, and so it's hardly ever seen. So I wouldn't worry too much about that one. And then iatrogenic botulism is where too much of the toxin is injected for cosmetic or medical reasons. So the symptoms of this disease are actually not caused by the bacteria itself, but rather the toxin that it produces. And so because it's a neurotoxin, it affects nerve cells. And so the first symptoms that start to appear are fatigue and weakness and vertigo, followed by the blurred vision and dry mouth and difficulty in swallowing and speaking, anything that's controlled by nerves, basically, especially motor nerves. These symptoms usually appear 12 to 36 hours after exposure, but there's a larger time period that they can appear in. That's just a little bit less common, anywhere from 6 hours to 10 days, but depending on the manifestation, but it's usually 12 to 36. If those initial symptoms are left untreated and you don't go in to see a doctor, paralysis can develop, specifically of legs, arms, and respiratory muscles. And so that can cause difficulty in breathing and just severe problems all around. Infant botulism appears in lethargy, constipation, weak cry, poor muscle tone, specifically the appearance of like a floppy baby. And so the image kind of shows what the floppy baby syndrome looks like. So it doesn't have the ability to use its muscles and stand like it normally would. So with those symptoms and going to seek medical treatment, diagnosis of botulism can actually be very difficult. These symptoms also appear as symptoms for a variety of other diseases as well. And so it might be difficult to diagnose botulism right away. The only way to be certain that it is botulism causing these symptoms is by laboratory tests of blood screens and looking for the toxin and bacteria in your system. But those lab tests can take a few days to actually be run. And so other tests such as brain scans, spinal fluid examination, and nerve function can also be used kind of to rule out some other diseases, but also to see if botulism is the cause of these symptoms. If the physician believes that botulism is the cause of your symptoms, they can start you on the treatment for it prior to the lab tests actually being confirming that botulism is the cause. And so this treatment is with an antitoxin. And so this toxin prevents further damage of nerves. And so the antitoxin binds to the toxin itself and prevents it from associating with your nerves, so preventing that further paralysis and complication of motor nerves. But it doesn't heal damage that's already been done. So anywhere where the toxin's already associated with nerves, it can't prevent damage or reverse damage that's already been done by that toxin. And so if paralysis has already occurred, or specifically respiratory paralysis, hospitalization might occur if these are severe symptoms. And so the paralysis luckily will improve on its own after quite a long period, because once the toxin starts disassociating with the nerves, nerve function can be regained, but it takes a very long time for this to occur, but it will improve on its own. Wound botulism may require surgical removal, just where the bacteria is in the body with that wound, because it keeps secreting the toxin. But also antibiotic treatment goes along with wound botulism. So botulism is a lethal disease, mainly due to that respiratory failure. But luckily, with the development of the antitoxin and improvements in medical care, the chances of death are very low. So about 50 years ago, we would have seen half the cases of botulism resulting in death, but now that number is reduced to only about 5 out of every 100 cases. So a lot of advancement there for the treatment and preventing death from this disease. However, there are long-term effects and complications that are associated with botulism. So patients who survive can have fatigue and shortness of breath for a number of years after treatment with the antitoxin. And this is just due to that long period, that like very slow improvement of nerve function and paralysis after the treatment. Also, if respiratory muscles have been affected, long-term therapy might be needed to aid recovery. And so that's like ventilators and such to improve respiratory function. To prevent botulism, there's a few ways to go about this. Since foodborne botulism is mainly caused by improper home canning techniques, following that safe home canning instructions is the best way to go about it, and ensuring the use of sterile equipment when canning. Also, avoiding contaminated food cans. This can present in a number of ways. There could be like a milky substance in the fluid of the canned products, or like the picture shows, the raised lid. Anything that just looks abnormal to canned food, or when you first canned it, I would just avoid that at all costs, because it could be contaminated with the bacteria or the toxin and cause botulism. To prevent wound botulism, you should keep all open skin lacerations clean, and if it becomes infected, seek medical attention right away. So I said earlier that infant botulism can't necessarily be prevented, and that's because one of the reservoirs of this bacteria is in the soil, and it can just be naturally found throughout environments, so such as even in your home, in the carpeting or flooring and such, because like dust particles and all that. And so infant botulism can't necessarily be prevented because of all of that, but it can be reduced if with the not giving honey to infants of less than 1 year olds, and that just is a way to prevent botulism by that mechanism. There is a vaccine that exists, but it is rarely used, and that's mainly because its effect isn't well known, and it can have like side effects to it that aren't desired. So just an added bonus of information that I found particularly interesting to this disease, the botulinum toxin can actually be used in a helpful way rather than in its disease route. Most of you have probably heard of it. Botox is the botulinum toxin. And so they use very diluted concentrations of the type A neurotoxin, and not only cosmetically in reducing wrinkles and all that, but it can be used medically as like a therapeutic to help muscle spasticity, migraines, disorders of hyperactive nerves, so neuropathic pain, some allergy symptoms, and it's even being looked at to treat chronic pain of patients. And so it's interesting that there's actually a benefit to this lethal toxin. There are limitations to its use, so you should be not just use it on your own. It should be a medical professional administering it, or a trained professional, because if it is injected to the wrong site or in the wrong dose, it can revert and cause botulism. So careful benefits applied to this toxin. So my sources, thank you for watching, and if you have any questions, I will be willing to answer them in class.